Thank you guys for coming on such short notice. I've got 4 simple questions for the Arkansas Department of Health and Dr. Smith. Number 1, if Travis McCready was playing music at a church 2 blocks from here on Friday, would it be permitted? Question number 2, if the answer to question number 1 is yes, would there be any greater public health risk for the people in attendance at a church event than there would be here at TempleLive? Question number 3. If the answer is yes to question number 2, that it is a greater risk, please explain the scientific data that transmission of COVID-19 or any other communicable disease is greater in the building that we're standing in right now. Question number 4. This is a good one. If there's no scientific data that supports the risk is greater in this building or any venue similar to it, why are we not under the same restrictions and guidelines or directives that those facilities are under? Governor Hutchinson referenced in his COVID update, I believe yesterday, restaurants and what would happen in the state of Arkansas and the citizens, and what would it look like if restaurants decided to open up before the May 11th directive that was issued upon them. It's not a fair analogy. If the directive for restaurants said that McDonald's could open on May 4th or May 11th or whatever day they wanted to pick, but Burger King and Wendy's weren't allowed to, they had to wait 2 weeks. And when they did open, they're limited to 50 people in their restaurant. And if they wanted more than 50 people, they then have to get additional approval to run up to a third of capacity. It's not a fair analogy. It's not the same thing. With that, I'm looking forward to your answers, Dr. Smith, to tell me that there's data that supports the risk of contracting this virus is any greater in this facility, TempleLive, on Friday night than it would be at any other church or religious facility that you are allowing people to assemble in without a directive, with no guidance on capacity, and just to follow CDC guidelines. We're not trying to be difficult here. We just want to be treated fairly and with respect like you guys are. It's not a fun job what you guys are doing, and this is a horrible time in our country. The world is watching. We have an opportunity to do a really good thing here for this state, the people of the state, and the people of this country. I look forward to your answers. We'll have a press conference tomorrow at TempleLive. Media is invited. It'll be at 1 o'clock, and we will have our answer on what we're going to do after we hear the response from Dr. Smith. That's all I got to say.